Hello everyone, I'm Dr. Sankeert Gangakhedkar. I'm a veterinary retinal surgeon at Keshav Nethralaya Eye Hospital, Hyderabad. And today our topic of discussion would be Retinopathy of Prematurity or ROP. Firstly, we would like to know what is retina. Retina is a light sensitive structure at the innermost part of the eye. Usually in retina, the blood vessels grow from the center of the retina and they go towards the periphery. What is ROP? ROP is the disease which occurs in premature infants who are born before 9 months of gestational age. In these babies, the blood vessels which are supposed to grow to the periphery of the retina stops growing, which leads to an immature retina. Sometimes in this immature retina, there is development of abnormal blood vessels. Sometimes these abnormal blood vessels bleed, which lead to vitreous hemorrhage and formation of scar tissue. This scar tissue causes wrinkling of the retina, leading to the separation of the retina, leading to a condition called retinal detachment, which leads to vision loss. Our next question is, who gets ROP? Usually, babies who are born prematurely before 9 months of gestational age, or babies who are born with very low birth weight, less than 2000 grams, with associated risk factors like poor weight gain, anemia, hypoxia, or babies who have been kept under incubation with oxygen therapy usually develop retinopathy of prematurity. How is the eye with ROP diagnosed? ROP diagnosis is usually done by a trained retinal surgeon. How is the eye examined with ROP? Usually, the eye examinations in newborns is done after installation of a dilatation eye drops of tropicamide and phenylephrine. After eye dilatation, the usual eye examination is done with the help of an indirect ophthalmoscope. What are the different stages of ROP? ROP usually passes through 6 stages. A stage 0 in which there is no ROP. In a stage 1, there is development of a line, a demarcation line between the immature and the mature retina. In the stage 2, this demarcation line increases in breadth and width and forms a ridge between the mature and the immature retina. In the stage 3, there is development of abnormal blood vessels, also called as neovascularization, at the edge of the ridge. In the stage 4, there is formation of the scar tissue leading to the retinal detachment, which is partial in nature. In stage 5, there is complete retinal detachment. This stage can lead to total blindness. How often do the eyes with ROP need screening? The usual screening for ROP varies upon the stage of the ROP. In babies with less severe form of ROP need eye examination until further complete maturity of retina. In babies with moderate ROP would usually require eye screening few days to few weeks. In babies with severe form of ROP, however, treatment or urgent treatment would be required. What are the various treatment forms of ROP? ROP is usually treated in 3 modalities. First is the laser treatment. In laser treatment, usually the immature retina of the eye or the abnormal blood vessels that grow in the eye are treated with the help of a laser. This procedure is usually done under topical anesthesia most of the times. However, a general anesthesia might also be required in babies who are larger in size or babies who are older. The next form of treatment is intravitreal anti-VEGF injections. VEGF is also known as an important component in development of ROP. Sometimes there might be need for both lasers and injections for treatment together. Surgical form of treatment would be required in a severe stages of ROP, that is when there is a retinal detachment that has developed in the baby, or there is associated vitreous hemorrhage. To summarize, ROP is one of the main causes of blindness in newborns and in premature babies. The good news is ROP can be timely prevented and treated if diagnosed early and treated promptly. ROP diagnosis would require proper screening and a prompt referral by a neonatologist and treating pediatrician. The various treatment forms of ROP include laser, injection and surgery. And lastly, तीस दिन रोशनी के. Thank you.